Some people say that men are from Mars and women are from Venus. Everyone sees the world differently. ADHD symptoms in a child could just be a trivial matter in the eyes of a father, but, in the eyes of a mother, they may be a disaster that needs fixing immediately. Such a conclusion did not come out of the blue. A study conducted by the Chinese University of Hong Kong in 2016 found that, compared to fathers, mothers tend to see their children's ADHD symptoms as more severe, and mothers' parental pressure on children is generally higher compared to fathers. I believe that many mothers would probably say, "Of course, he doesn't take it seriously." But you'd be surprised. It only takes 3 months to change parents' views on their children's ADHD symptoms. In this video, I want to introduce to you the multiple family group. As the name suggests, this therapeutic method integrates both family therapy and group therapy. A social exchange platform is created for families who are facing similar difficulties, using a series of group activities to revisit their family situations. Sometimes, miracles happen in these groups. When we say therapy, we don't mean there is one particular member of the family who needs to be treated. Rather, it is about facilitating the members of the family to relate in a way that enables them to explore alternative familial experiences and receive support in between. This way, the whole family can move on from their problems together. The Chinese University of Hong Kong applied this method to work with Chinese families with children diagnosed with ADHD. 66 families took part in the therapy and were divided into groups consisting of 4 to 7 families. Within 3 months, these families needed to attend a half-day psychoeducational talk, 4 full-day family group programs, a total of 32 hours, as well as 2 half-day reunions. So, what happens during such an intensive family meetup? Each session usually starts with some icebreaker games. These are followed either by activities designed for family members to enjoy time with each other, such as creating their own family stories, or activities for families to interact and have fun with other families, such as a game called Swapping Our Mums. Another interesting activity is the joint meal preparation, in which parents and children from different families take part together. This way, parents can have a chance to experience ADHD by communicating with children from other families. People say the grass is always greener on the other side of the fence, but do the children from other families actually behave better? Of course, it does not mean that the children from other families behave better in reality. We are just less strict about their ADHD symptoms when we are around these children. The researchers of this study explained that the activity encouraged parents to enjoy the time with these kids without their usual bias about ADHD. The findings of the study revealed that after 3 months of treatment, parents who participated in this therapy began to perceive their children's ADHD symptoms to be less severe than before. This change was likely to be inspired by their participatory experiences in the group. After joining the group, the parents became less focused on the ADHD symptoms and started looking at their children from a different angle. As you may know, an ADHD diagnosis is usually based on the information provided by the parents, which could be influenced by their view of their children. As the parents find a new way of looking at their children's behavior, it helps the doctors to make a more accurate diagnosis. Children also felt that their parents became more patient after joining the group. Even their tone of voice in asking them to do their homework had changed. What contributed to these changes? Researchers said that these parents and children had very little time to spend with each other. Very often, their family time was overwhelmed by some rather trivial things. However, in the multiple family group, they could not only have a safe space to enjoy themselves, but also re-experience the positive interactions in the family. What's more, they were able to meet people who shared similar experiences with them and develop mutual support among themselves. You may ask, how can I help my child if I don't have the opportunity to participate in this study and get help from the researchers? In fact, this experiment was not an easy task, as it required families to spare 42 hours of their time in 3 months to participate. An important belief in the multiple family group is that every family can heal itself. When members of a family no longer attend to the faults and problems of one another, but attend to their strengths instead, even a tiny change in a member can create a ripple effect in the family, which, in turn, will help everyone grow. Of course, there is no need for you to swap your children with other families, but the thing you can try from now on is to change the way you see your child. With that, you may discover something entirely new.